The first question of what does a session or meeting outdoors, we have flies in Australia, as you can see, look like, and how does one make that possible with groups or individuals? So the structure of my session, if I was going to do one, is I've done a lot of prep work. I probably have some idea that the client wants to do this type of session with me. If it's an expedition, a multi-day camp, obviously I have to do much more planning than if we're going on a walk or going to the beach, things like this. So one of the things I'm doing when the client gets there is I am doing a bit of a check-in. I do a lot of research about the work I do. I use something called the outcome rating scale. It takes about 1 minute for the client to fill out. And I do that every meeting. So while that seems like a lot, it takes almost no time and clients don't really care about filling it out. But what it typically tells me is if the client's feeling better, worse, the same than the last time we met. Ideally, they're feeling better if they're in a good place, or they're feeling better if they were struggling last week, or they're the same if they're reporting things are going pretty well. So I want to make the outdoor session related to how they've said they're going in life. So I don't just want to keep doing outdoor session after outdoor session that is not related to their goals for coming to see me. I want it to be, so it's really nice to go rock climbing. Most of us have gone rock climbing before, but what makes that therapy is more how it relates to treatment goals, that sort of thing. So when I end a session, so I do that at the start. That might take 1 to 3 to 5 minutes. We go out on our adventure. At the end of the session, I'll ask, how was that session? And I actually want them to give me a bit of detail. I'm not really interested in them saying, that was great, thank you, see you later. I'm much more interested in what I can do next time to be a better practitioner outdoors. For some people, and I think it's important to know that while we have a lot of research that being outside is good for our well-being, and it's good for all these different benefits, we have no research none of that research comes from therapy. It usually comes from university campuses or in communities or in schools. So when we're talking therapy, we have to have a goal and there's a purpose of our relationship. So I want to make sure that the client is experiencing something that seems beneficial. If that is just being outside, that's fantastic. But I can't make that assumption because they could be scared, cold, nervous, traumatized when they're outside, right? Just a few weeks ago, I swam out in the ocean to get a boat that I had buoyed to an anchor, and it was only like 2 meters deep, and 10 minutes later, a huge great white shark was seen there. So I was having fun in nature, but it could have easily just killed me. So I think it's good to avoid sort of really simple ideas that nature is healing and think about finishing that thought with nature is healing for who and why. So the session at the end, I'm really asking what was most important. I'm not going to guess what was most important for another person. And so when I ask that, I want them to tell me so I know next session, I can try to do more of what was most important.